Hello everyone. Today we talk about a very interesting, a unique and very important topic, that is what is the relationship between sleep disorders and gut, and do they have a relationship, how the disorders of sleep are influencing the disorders of gut and vice versa. So we will go through the talk today in the following headings. We just understand how the gut and the sleep are connected. Then we will try to know the basic pathophysiology behind sleep disorders and gut health and how they are linked. So this we will understand keeping in mind the precision medicine which is the present and the future, and how this knowledge can be helped in therapeutic and better management towards sleep and gut disorders, and of course the future prospects also. So interesting as it may seem, there are 400 times more melatonin producing more melatonin production in the gut than in the pineal gland. So serotonin gets synthesized into melatonin, and this serotonin is produced in a lot of amount by the gut. This is responsible for setting your circadian rhythm. This melatonin is responsible for induction of sleep. But being produced in such large quantities, definitely there is something more to it than mere circadian rhythm. And very interestingly, researchers have now found that melatonin has a role in immune mechanisms of the gut, in gut motility, in preventing the gut and in endothelial prevention of endothelial damage of the gut, in uh, managing the peripheral circadian oscillators which are situated in the gut. So melatonin is in fact very useful for maintaining the normal gut mechanisms and function. Again, it is not just melatonin which is linking the gut to the brain. In the gut, there is there are a lot of bacterial and viral and fungal, whatever the microbiota is present in the gut, which is good if it is diverse, because that microbiota, those bacterias which are in symbiotic relationship with human beings, which are helpful to us, and in terms of their sheer number, they are almost 10 to the power of 14 times our genome as compared to bacterial genomes. So, will it be something exaggerated to say we have more of bacteria in us than our own cells? And these bacteria are producing norepinephrine, they are producing dopamine, they are producing GABA. Norepinephrine is important in REM sleep. Dopamine is again important for so many sleep related functions and so many brain functions. GABA is one which is responsible, and for sleep induction, it acts on the sleep switch in the preoptic nuclei of brain, and that GABA is also to a large extent synthesized in the gut besides brain. Now, is it all? Is it just the neurotransmitters which are influencing sleep and they are produced in the gut? No. Other mechanisms like metabolic mechanisms of these microbiota, whatever metabolites is being then carried from the via the blood, crossing the blood-brain barrier, and that also is influencing sleep. Hormonal signals which are being produced, neuronal spikes by way of the vagus nerve, which is connecting the gut and the brain. Everything that is happening in the gut is responsible for influencing our sleep. Now, it was said that you become what you eat, and we can add to it that we sleep. Our sleep is as good as the food that we eat, as good as our gut, because if it's a healthy gut, we'll have a healthy and good sleep. Now, talking about the common sleep disorders. Sleep disorders is something that there are like over 85 sleep disorders which are known to us. But there are a few which are common, more prevalent, and we will discuss those today in context of gut and how the gut influences these disorders, and how these pathway of interactions between the gut and the mechanism causing these disorders can be used to prevent, mitigate, and perhaps to treat these disorders. So once we know it will be really useful for us while managing these sleep disorders or while managing these gut disorders linked to sleep issues. One is insomnia, then is sleep-related breathing disorders, then are the central disorders of hypersomnolence, then are circadian rhythm sleep-wake disorders, the parasomnias, and sleep-related movement disorders. So, what are the factors which regulate sleep? Commonly known factors which regulate sleep and which, when disturbed, they commonly lead to a condition called insomnia, which is the most prevalent of all sleep disorders. So, sleep could be regulated by your genes. There are some people who are good sleepers. There are some who are genetically prone to sleep disturbances. They have short sleep. They have more fragmented sleep. They are more prone to wake up multiple times in the night. So there are emotions. Your emotions affect your sleep. The environment you sleep in, your bedroom environment, the temperature, the level of intensity of darkness, your sleep wake habits, how regular or irregular they are, they will influence sleep. The presence of disease or no disease, whenever you are having a disease, that definitely is influencing your sleep. We had the terminology till very late called secondary insomnia, where insomnia linked to sleep disorders. We were talking about those kinds of sleep issues where some comorbidity was present and was directly related to that insomnia. Again, we have external chemicals by way of the drugs we take, by way of uh, other medicine that we might be taking. So, in all these things, I felt there was one very important regulatory factor which was missing, which is commonly not talked because maybe this is a very recent topic of research, very recent topic of discussion, and it's a futuristic medicine because what we don't talk about is how gut influences sleep, and very directly, gut is influencing sleep. So, this is the missing factor amongst all the sleep regulatory factors. Now, insomnia is widely prevalent, and so is sleep apnea, restless leg syndrome. So, these are the statistics from India from a systematic review which was conducted last year, and the sample size was pretty large. So, looking at the fact that we are a population of more than a billion, these figures could go into millions and millions of people who are affected by these sleep disorders. Now, let's talk of insomnia and the gut. So, insomnia, what is it? It is a common sleep disorder and it can present as either you have difficulty to fall asleep, we are there in the bed tossing and we cannot sleep for maybe an hour, half an hour or more, and the person has the sleep latency is long, or he or she wakes up several times in the course of the night, or they wake up too early. So it could be either of these three different subtypes of insomnia. So again, sleep is a dynamic process like the gut microbiota. Sleep is anything but something which is passive. So when a person is sleeping, he is anything but the body is anything but in the passive mode. Sleep is the most active mode. REM sleep activity is just like the activity during wake. It is that time that your brain is getting detoxified. It is that time that entire housekeeping is active. All the genes are getting corrected, all the neurons are new connections are being formed. So maybe is a known saying that sleep is the cost of neuronal plasticity. So we are making new memories, we are erasing the old memories, we are cleaning the entire body system. It's getting detoxified, especially the brain is getting detoxified of all the amyloids and proteins and metabolic debris. So fresh up for the next day so we can think and have proper cognition and memory. Sleep is something very important for immunity. Sleep is very, very important for maintaining your normal body functioning at the optimal level. So it's very dynamic process and it has subtypes to it. It has sections to it because we don't sleep in a straight line. There are always stages and every stage has some important role. And there could be diseases associated with different stages. Like you could have non-REM sleep disorders, you could have REM sleep disorders, and some disorders which are more prevalent in one stage than other. So it's a very dynamic phenomena. And anything which is disturbing the sleep regulating factors that can lead to insomnia. So any of the conditions that we discussed could lead to insomnia. Now, why will you have any gut issue when you have insomnia? So, and is it that insomnia leads to gut issue or gut issue leads to insomnia? It's just like the chicken or the hen story. It could be somebody who has insomnia will have because of that disturbed sleep rhythm. Insomnia is a condition which is considered a chronic inflammatory condition. It's a condition of constant sleep deprivation. It's a condition where we are deprived of sleep, where we are in a sleep debt for a very, very long time, and that is leading to accumulation of free radicals, to oxidative stress, inflammatory milieu is being produced, and that is all leading to gut dysbiosis. So again, this is one thing. Secondly, there are bacteria in the gut which produce chemicals like serotonin, like melatonin, which of course is it's a product of serotonin, like GABA, and they are helping us sleep. So maybe when there's a disturbance in the gut, there's disturbance in the sleep. When there's a disturbance in the sleep, there's disturbance in the gut. So it is you cannot say which one comes first. So it is a bidirectional relationship. And 74% of individuals who have irritable bowel syndrome, they have reported sleep disturbance of some kind. So either they say we have a fragmented sleep, or they're having a non-consolidated sleep. They're shifting to the lighter stages every now and then. They're not able to reach those deep sleep phases. So anything is happening. It's definitely linked to gut health. Now, insomnia and gut health, they are so well correlated. Uh, so what conclusions can we draw because of it, and which way can we really help the patients of insomnia or gut issues through the knowledge, the advanced knowledge that we are now getting? So one very interesting fact is that patients of disorders of gut-brain axis or gut-brain interactions like IBS, they have shown very promising results with CBTI, that is the cognitive behavior therapy for insomnia. This therapy is targeted towards behavioral changes. It is targeted towards acting on disbeliefs and attitudes which are promoting that increase in sleep. It could be so many, so many of us are not very clear about the time of nap, the duration of nap. So many of uh, so many of us are okay with going to sleep at 2 a.m. Many students, many youngsters, many of us are willingly compromising our sleep every day, every few days for so many reasons like socializing or anything. That we are the only species to voluntarily curtail sleep. So CBTI has shown very good results and promising results with these patients. Secondly, there is, I think I've used a very strong language there, sleep targeted probiotics could be the future of insomnia or sleep disturbances, though it is very early and they will not definitely, it is not replace, but I should say they will complement hypnotics, and they will make the fight against sleep disorders more potent, because then these probiotics and these engineered probiotics will be able to target production of those bacteria which are producing neurotransmitters, which is helping them to sleep. So that is a far long process which is futuristic, but for now we can be happy with that certain a lot of work is being done across the globe with keeping this in mind, and these kinds of products may come as the future of sleep medicine. So now the second disorder, and this is OSA and gut health. Now, what is obstructive sleep apnea? We all know what it is. It is one disorder which is created havoc around the globe, which is the most noticeable sleep disorder, which is the one with which most of the patients of sleep disorder come to sleep clinics or report to their physician, because people tolerate insomnia a lot. They usually present very late. It's usually the last thing that they will add on to whatever clinical history they present to their physician, that yes, I also don't sleep well. Then of course it's up to the clinician, or it's up to the physician to elaborate what that sleep disturbance is all about and treat it accordingly. Otherwise, people are not so, they hardly will come to you that my only and only issue is not being able to sleep. It has to have some layering to it, of course. But OSA is one thing where the patients come Most of the patients in sleep clinic are coming at this, I mean, in the present scenario for OSA related complaints. Unfortunately, they are also presenting very late, because by the time they come to the clinics, they have developed some or the other metabolic disorder. Like we're talking about diabetes, which is very closely linked to sleep apnea, like hypertension, like coronary artery disease, like obesity. They have depression, whatever. So, speak of an illness and it is correlated to sleep apnea. The simple, very simple reason being it is not the apnea which is uh, doing the problem, which is creating the havoc. It is the apnea leading to intermittent hypoxia, causing sleep deficiency, intermittent hypoxia again causing release of free radical, again causing oxidative stress related injuries, creating a pro-inflammatory milieu, gut dysbiosis, metabolic disorders. So now all this seems so well linked. Okay, when I was talking of OSA, usually we don't talk about the gut. We don't include gut into the picture of OSA. But now, keeping this fact in mind that gut is producing maximum neurotransmitters needed for sleep, OSA is creating such an intense oxidative stress and intermittent hypoxic situation. Definitely gut is is suffering. And so again, one very important thing also is that even GRD is related to acid, because GRD will cause mucosal thickening, it will cause reflux of gastric acid, and that will predispose somebody to have sleep apnea because of acidic reflux. In turn, OSA also causes GRD, because when a person has OSA, there's a negative intrathoracic pressure. You can just allow the acid to enter into the upper airway. So both of them have shown uh, a mutualistic correlation amongst each other. And very important is, traditionally OSA treatment was involving dental devices, pap pressure, surgery. Now we are also focusing on OSA endotypes for the treatment, in terms of which subset of patients will benefit with oxygen therapy, which subset will benefit with nerve stimulation, which subset will benefit with some other kind of intervention, like maybe hypnotics can be beneficial to a particular subset. So the treatment strategies are now progressing, but very importantly, what we are actually missing is promoting antioxidants, probiotics, and in patients of OSA, because if nothing, they will improve the quality of life of these patients. Because what they will do is that they will mitigate the adverse end outcomes of inflammatory damage, which these patients are suffering every single night, that they are sleeping with their sleep apnea, that they're sleeping without their uh, corrective measures, whatever intervention has been given to them by way of a PAP therapy, by way of a surgery, by way of weight reduction, and they are still having those hypoxic spells. So they are having inflammation. So it's better to provide them something to deal with it as well. And of course, antioxidant therapy has shown improved endothelial function, reduced oxidative stress, and improved sleep parameters. Now, let us talk about RLS and gut health. What is RLS, or restless leg syndrome? It is again a very common sleep related movement disorder, and it's a disorder which causes overwhelming urge to move legs, and it is usually associated with unpleasant sensation, often during sleep, and it's relieved by movements, and it disturbs sleep and it prohibits deep sleep. So patient has a fragmented, poor quality sleep. Causes could be hereditary, neurotransmitter related abnormalities. Maybe it is something related to do with dopamine and other neurotransmitters in the brain. RN deficiency also leads to RLS. It has been shown that two-thirds of patients who have RLS also have some kind of a small intestinal bowel obstruction, or this is something which is very important. So, or I'm sorry, small intestinal bacterial overload. So this condition of SIBO, or bacterial overload in the small intestine, it can disrupt the intestinal lining, because there are a lot of bacteria and the endothelium is getting damaged and compromised, because of which an inflammatory milieu is being set up, and TNF alpha, L6, and all these inflammatory markers are released into the circulation. One more thing that can work towards causing RLS in such patients is that there is a decreased iron absorption by the intestine because of this bacterial overgrowth. And it has been shown that whenever antibiotics are provided for small intestinal bacterial overgrowth, they are improving RLS also. So if a patient comes with the symptoms of RLS and they have fat intolerance, or they have abdominal discomfort, we can always think in terms of maybe this patient has bacterial overgrowth, and maybe an antibiotic therapy can help for managing RLS. Now, something which I feel is very important and missed most of the time is the circadian rhythm sleep wake disorders. So these disorders stem from a person's internal circadian rhythm which is not aligned with their environment. So in general, there is an alignment between our internal clock and the environmental light and dark. So which is the best in trainer or the Zeitgeber? That's the sunlight. When a child is born into this world, they have no circadian rhythm. Usually, the circadian rhythm develop gradually, maybe in 3 to 4 months, the child will have some kind of a circadian rhythmicity. And how do these rhythms develop? So they will develop first and foremost because of light exposure. So when they're out of the mother's womb, they will have enough of light, and the light is a clue to the brain this is daytime. People who are congenitally blind, they develop their rhythms based on food timings, based on noises around them, based on smells and noises in food. So there are other external entrainers or Z-gibbers, whatever. And the important thing is that it is not just a suprachiasmatic nuclei which is getting entrained or which is reacting to light and dark. There are peripheral circadian oscillators in every organ, tissue, and cell of the body, from your pancreas to your gut, to your kidney, to your liver, to your intestines, to stomach, to heart, lungs. Everywhere we have circadian oscillators, and they have their own independent circadian trajectories. Now, so whenever there's this disturbance, what happens is that there's a disturbance in the gut immunity, and there's an increase in inflammatory markers because we're not following the circadian rhythm. The correct timing of release of enzymes, hormones, metabolites is getting disturbed. Inflammatory markers are setting up. The timing of food eating is being disturbed. The timing of element, everything, every single thing is in desynchrony. Because of that kind of an inflammatory milieu being built up, inflammatory bowel disorders are very common in patients of circadian rhythm sleep wake disorders, and it is important that such disorders are diagnosed. They are commonly not diagnosed, or they are treated as insomnia. We have to be very clear while such patients are coming that this is patient who has a circadian rhythm disturbance and needs some kind of phase resetting using light therapy, a chronotherapy, a melatonin treatment, and that is important. And again, I think it is important that even on OPD basis, tools to monitor the circadian rhythm, if not actigraphy, no, not required at all. And simple tools like a sleep log or sleep diary, they can be used widely. They are available, freely available, and they can easily be used for diagnosis of these disorders. Now, I would like to conclude with uh, this talk with is that the transition from disease care to a healthcare society should be the most important uh, conclusion based on the present talk, because what we could conclude was any disturbance in the circadian rhythm, any disturbance in the gut microbiota, any disturbance in our sleeping habits, anything which is going out of the way, any kind of sleep apnea, any sleep issues, is building up a condition of inflammation in the body, is building up, and then that is leading to further disease process. So it is better than managing those disease. We manage the health, provide prophylaxis, provide correct guidance, provide timely interventions in form of explaining to the patient what is the basic parameters of sleep hygiene. That kind of awareness has to be stressed because we talk a lot about the right food, when to eat and what not to eat. We also talk about how much to exercise, when to exercise, what all exercises you can do. Let us also talk about how to sleep well, what's the importance of sleeping on time, how we can actually improve our sleep hygiene by being regular in sleep schedule, by having a fixed bedtime routine, by avoiding just lying idle on bed, and whenever you cannot sleep for a prompt, is better to leave the bed so that your conditioning is not disturbed, and other principles of sleep hygiene, they have to be brought in notice of the public or community. Again, as important as sleep is, as gut microbiota, so it is important that we practice diversity of gut microbiota through healthy eating practices, so that we have enough of bacteria which can synthesize short chain fatty acids, which can digest fiber, which can digest complex carbs, which can release healthy metabolites which are important for overall functioning of the body. So again, very important conclusion is we have to focus on somebody's chronotype. That's very important because everybody has a different chronotype, which is by birth, an environment that they live in, the lifestyle they have been following, for prevention and management of so many sleep and gut disorders. So again, that was it. And it's very important to realize that sleep is something which is a necessity and not a luxury or a leisure. So that has to be stressed upon. These are the ways how we can probably develop and grow towards the realms of precision medicine and provide better diagnosis and better care to those in need. Thank you so much.